polymer. Looking to this interesting study, a meta-analysis of 30 articles looking into body weight effect of fasting Ramadan in healthy people, overall there was a considerable amount of weight loss. More in males who showed significant loss, much less in females. Regarding the lipid profiles, females remained unchanged. Male group of these meta-analyses showed substantial reduction in total cholesterol and triglycerides. Low-density lipoproteins and fasting blood glucose were decreased in both sexes compared to levels before Ramadan. So the conclusion was that Ramadan can change and have an effect on body weight in general. Now let me start with Ramadan effect on people with diabetes. This study is really a very old one, back in 1989. This was one of our first studies, me and Dr. Munira, when we were involved, and we showed our interest in diabetes and Ramadan. We studied 36 non-insulin dependent patients. These are type 2. At that time we called them non-insulin dependent. All were well controlled. We studied them for the effect of fasting Ramadan on their glycemic control, other metabolic parameters, and the body weight. And the results showed no significant changes in glycemic control, no change in lipid profile, and significant increase in weight in fact. We concluded that fasting do not have adverse metabolic effect in well-controlled subjects. However, dietary control should be considered to avoid weight gain. When I reviewed the literature to look into the effect of Ramadan on people with diabetes, this review of literature showed controversy, in fact, about weight gain specifically. During Ramadan, in one group of these studies, patients had an increase in body weight. In another group, there was no change in body weight, and in a third group, there showed some drop or decrease in body weight. While no food or drink is consumed during the day, there is no restriction on amount of type of food after breakfast. This may play an important part in affecting the outcome of fasting on people with diabetes. And most of diabetics reduce their daily activities during Ramadan in fear of hypoglycemia. This can be another factor. And all these factors can have an influence on body weight. Now coming to oral drugs used for type 2 diabetes and the effect on body weight and fasting Ramadan. Metformin, of course, is the first line of our treatment. Although we don't have randomized controlled trials on metformin and fasting Ramadan, however, it's very well known that the risk of both hypoglycemia and effect on weight is very much reduced. So we can safely say that there is no increase in weight in people or subjects using metformin during Ramadan and fasting people with type 2 diabetes. Same could apply for alpha-glucosidase inhibitor. No randomized controlled trials, and the risk of hypoglycemia and weight gain is quite low. So again, we can consider them safe regarding weight gain during fasting in people with diabetes. TZDs, we have one large or relatively large randomized controlled trial in 86 subjects. They showed no significant difference in hypoglycemia. However, the body weight significantly increased in people on the group of pioglitazones, which was the TZD studied in this protocol. So we can say safely that TZDs will result in significant increase in body weight. Sulfonylureas, and we are well aware that they are factors for adding weight, and in different studies comparing different types of newer generation and older generation of sulfonylurea, they all show different degrees of gaining in weight. Of course, some newer generations have a less effect of body weight, but in general, sulfonylureas can result in weight gain during Ramadan and type 2 diabetes. DPP-4 inhibitors will show, I mean, in this study there was a comparison between vildagliptin and sulfonylurea, and the vildagliptin group showed less effect on body weight, or in fact, some reduction in body weight. GLP-1 agonist, this is the liraglutide versus sulfonylurea in Ramadan study in 99 subjects, and there was a significant loss of weight in the liraglutide group, and we can consider it as a factor which can promote weight loss in Ramadan and in normal life situations. This is another study, liraglutide and another group of sulfonylurea, 333 subjects. Again, a significant reduction in body weight in the lira group. Now, there are risks we have to avoid during Ramadan. In addition to gaining weight, hypoglycemia, especially in the period before iftar time, after a long day of fasting, severe hypoglycemia after breaking the fast, dehydration, especially in our region, in countries where prolonged fasting hours and hot climates, significant weight gain due to increased calorie intake after breaking the fast, drop in physical activities, and the type of medication we are using, in addition to electrolytes imbalance and acute renal problem in patients prone to severe dehydration, particularly in elderly subjects and those with impaired renal function. Now, the main aims of a nutrition plan during Ramadan should be, and this is from Osama Hamdi from Joseph Clinic in Boston, to consume an adequate amount of calories with a balanced proportion of macronutrients during the non-fasting period. This is to prevent mainly the hypoglycemia during the fasting hours, and to distribute the carbohydrate intake equally among meals to minimize the prolonged postprandial hyperglycemia. And we have also to consider the comorbidities. When we talk about a diet during Ramadan or diet in general, we have to plan it in a way which is accepted to our subjects. Now, the pre-Ramadan visit is very, very important issue. It's exactly like Dr. Salaf suggested, the pre-Hajj visit. Now, an assessment of patients' nutrition should be a part of our pre-Ramadan visit, which is 6 to 8 weeks before the start of the holy month. Provide an opportunity for our team. This is not one-person show. It has to be team, educators, nutritionists, physicians, to advise their patients about the necessary dietary modifications that should be adopted during Ramadan, and to provide a modified nutrition plan that help improve glycemic control. Provide a plan that may help overweight and obese people to lose some weight, to take the opportunity of this long hour of fasting and lose some weight. Adjust anti-diabetic medication in line with the change of nutrition. Encourage proper exercise and physical activity. Provide education and help recognize the warning symptoms of dehydration, hypoglycemia, and other possible complications. Enforce the importance of self-monitoring during the whole days of fasting and non-fasting period. Now, this is an interesting study, the READ study program, when they compared in two groups. Group A has received structured education program about physical activity, meal planning, glucose monitoring, hypoglycemia dosage, and timing of medication. Group B used the usual clinical visits with the usual routine advices. Results were really impressive. 0.7 kilogram loss in Group A versus 0.6 kilo gain in Group B. That was very significant. Weight changes were independent of treatment agents used. Significant decrease in number of hypoglycemia events in Group A compared to Group B, and that also was very significant. The conclusion was that Ramadan-focused structured education in diabetes can empower patients to change their lifestyle during Ramadan, which will result in less hypoglycemia and possibly some weight reduction. As I said, it's a matter of designing a meal for our subjects. see what patients are preferred stuff used as I like, not as you like. If this doesn't happen, people will keep cheating on diet. Nobody can follow a diet which he doesn't like. So to conclude, chairpersons, ladies and gentlemen, weight gain during Ramadan should, and I think can be avoided. Overweight and obese patients may find that Ramadan is a good opportunity to lose some weight. Weight loss may result in a significant improvement in glycemia and may reduce other cardiovascular risks. In order to achieve weight loss or avoid weight gain, calorie intake should be controlled. Pre-Ramadan structured education program can help in avoiding weight gain and better glycemic control. And I'll end by reminding you about our ideal Congress coming in Abu Dhabi next December. And thank you for your
Thank you, Dr. Abdullah, for this interesting talk. I think this session is very important as it covers most important two topics that we are facing every year, one before Ramadan and before Hajj. I think we will open now the floor for the discussion, and can I call Dr. Solak also to come to join us here and Abdullah for discussion. Now, any question from the floor?
Some relative contraindication for diabetic patient to make Hajj. In special situation in a diabetic patient, not to be allowed to make Hajj. That's the first question. Second question is some modification during the Hajj procedure for diabetic patients. For example, during making Umrah, Tawaf and Umrah, make Sa'i and make Tawaf. Can split Hajj as a Tawaf first and make some rest, test the blood sugar, and then make Sa'i. For example, use the wheels, not walking. Make Tawkeel for restoring. Some recommendations for diabetic patients during especially insulin-dependent and uncontrolled patients.
Thank you very much for your question. I'll answer the second question first. Definitely, you're absolutely right, because what we will be telling our diabetic patients is trying to reduce the mobility as much as they can. They can be carried or pushed using a wheelchair, and I saw some cars that you can sit together and they're like electronically driven, and if you advise them to try to avoid, even Jamrat is very, mashallah, it's a very bigger space now, and the Saudi authorities have mapped it out and organized it very fabulously, that there is never any overcrowding. Whatever time we went, it was almost empty. So if they want to go themselves, they can be pushed using a push chair, wheelchair, sorry. And if they want to go, if they ممكن يوكلوا, توكيل is a very good idea as well. And avoid moving around when it's sunny. Move around after Maghrib when it's a bit cooler. So there are many possibilities, and monitoring the blood glucose between the Tawaf and Sa'i is also feasible, and they can walk slowly. There's no need to rush around, and they can take their time while walking. This is a very good advice also to give, and try to avoid the times. There are certain times when there is a lot of crowd, and certain times when the Tawaf is very light and the Sa'i as well is very light. So I totally agree with you. There are many, many possibilities. And I think by the end of the day, we need to individualize these things. I mean, whatever the type of caravan they're going with, what they're going to face, they also need to know these details as well. I'm sorry about the first question.
Regarding the relative contraindication.
Yeah. Well, this is a very difficult question. هدخل في حق الله.
Many of them died during Hajj, in serious conditions.
Yes. What I really think is they have to ask a professional about this. I mean, as a physician, unless I know a lot about this, then I can tell them there's no need to go to Hajj this year, maybe, because Hajj is something very sacred, and it is one of the pillars of Islam. If you can do it, you have to do it. So maybe you choose the month that is when Hajj is in the cooler months. Have somebody accompany you to help you through, and then I think you have to have a higher opinion as well.
I join your instructions or advices to have guidelines for Hajj and the Umrah also. But for the time being, don't you see that you can put a compulsory medical record for each Hajj before traveling, or which will agree before traveling and before Umrah, detailing the issues which could be present for this pilgrim during his travel, and advice, whatever the advice, whether the wheels or tawkeel or whatever.
Yes. In fact, this is one, if you remember the slide before last, where I talked about the 211 Saudi Arabian decree about the before Hajj, what you have to do before you travel and what you have to do during travel. Before travel, one of the items is to ask your medical practitioner to give you a full detailed report of your condition, the medication and the doses and everything. So it's well mentioned. But we need to stress it, you're absolutely right.
It should be a compulsory
Yeah,
one, I think.
it has to be
have
stressed.
to
Definitely, yes, definitely. Thank you.
Now, I like your slide when you say we have to involve our colleagues in Saudi Arabia. I think we have to build our facts and data. We have to create and develop studies to show the outcomes of Hajj among people with diabetes. Building just a part of information will take us to step two, like what we did in Ramadan. Our work in Ramadan led to fatwa from Al-Azhar, allowing us to tell people to fast or to fast. So a similar stage can be taken. We have data. A joint committee, religious people and physicians, will come up with recommendations which can be endorsed by fatwas, and all these things will give us power. When we tell somebody don't go to Hajj this year, wait another year, you will have the backup of religion and science at the same time.
Thank you, Dr. Abdullah. Absolutely right. Thank you.
Another question from the floor.
Professor Soler, I would like to thank you very much for your comprehensive talk. I have one question. Some Egyptian women take contraceptive pills during Hajj. I know that contraceptive pills may increase the blood glucose. In these cases, how you can do with this woman? Increase antidiabetic or small doses? How the exact dose? Thank you.
Thank you very much for this question. As far as I'm aware, the effect of contraceptive pills on the blood sugar is not really that very high. But as part of your general advice for those ladies is that, they're diabetic of course, is that they have to do continuous glucose monitoring before exercise, I mean before walking long areas, long periods of time, before they go through tawaf, before they go through Hajj. And as mentioned by our dear professors here, between tawaf and sa'i, they have to monitor their blood sugar, and they have to be well educated. That is why it's very important they have the pre-Hajj education, like the pre-Ramadan education, the pre-Hajj education. It's to show them, whenever they find their blood sugars are on the high side, to increase either their insulin dose or to increase their oral antidiabetic agents. So education, we go back again to education. Thank you.
Okay, I think we have to close this session. We are out of time. I'd like to thank now Professor Tulaf and Professor Abdullah for their interesting presentation, and to thank my co-chairs, and thank you very much.